Good morning, ladies and gentlemen. This is Pastor Bruce. Welcome to my podcast, One Man's Opinion. I hope that at the end of this podcast, you will not only inform your friends to listen to it, but send it off to your representatives to have them listen to it as well. Because this, ladies and gentlemen, is a very important podcast on our medical system today. Now, part of the problem, what we have, they used to have what's known as an 80-20 program. Pretty much everybody was involved in an 80-20. The insurance companies picked up 80, the people picked up 20% of the cost. That started to get outrageous. So in 1973, they came up with the Health Maintenance Organization. Or they created little pockets of private pools for you to attend and get your medical coverage. And everybody had to join these pools. And even the doctors and the hospitals, join us in our HMO and we'll take care of you. So doctors and hospitals raised their prices. Now we're at a point where we have a medical insurance that nobody wants. When they went out to promote the Affordable Health Care Act controlled by the federal government, even the Democrats out there, the hard-working, back-breaking Democrats said we don't want federal government involved in our health care program. So when they had the opportunity of getting rid of Obamacare, thanks to people like McCain, we kept it. Now here's the problem. The Republicans are still trying to create a government-controlled health care system. Why? Because it's socialized medicine, and if you've listened to any of my podcasts, you'll understand that the UN wants America to become socialist so they can adopt the socialist government of the UN in 2030 when they take control of the world. We don't want that. Put the health insurance back into the hands of the health insurance companies. And here's a simple plan of how we can do it. And I say simple because it's just an outline. We can work further on it. No more government control of insurance. Get rid of that. The government should not be involved in any insurance policies such as Medicare or your private insurance. Open the borders for insurance companies to go into all 50 states, just like insurance companies for cars. I had Allstate in New York. I moved to New Hampshire, I had Allstate. I moved to California, I had Allstate. I moved to Arizona, I had Allstate. I moved to New Mexico, I had Allstate. So wherever I go, I have the same insurance company. You can't do that with health insurance companies. You have to find an insurance company in the state. Wrong, okay? Wrong. They should be able to go from state to state with the same insurance. Now, so the government should sit there and say, okay, we're opening borders. Then they have to regulate the prices of the insurance company. You are no longer going to pay outrageous prices for your premiums. And here's a small outline of what we can do. Basic medical coverage from the time you're 1 year old until you're 999. You pay basic coverage of $100. That's it. Now that $100 allows you to go into the doctor, be examined, get your prescriptions if you need prescriptions, get your different shots that you need throughout the course of your life if you need shots. And that's what's covered. Whatever you don't use goes into a health insurance account, savings account, excuse me. And if everybody does that, goes into the health savings account, which everybody won't, and we'll get to that in a minute. Well, let's say it this way. For everybody who's buying their own insurance, whatever's not used goes into the health savings account. And that health savings account is invested back into the country. And the dividends and interest come down, and it's divided three ways. And we'll explain that in a second. So you regulate the pricing. Basic coverage, $100 per person in the country. So if you're a family of four, you just want basic coverage, you walk into your, if both couples are working, they walk in, they say, well, it's $400, but my husband's got $200, I have $200. Their corporations or their businesses will pay $100. So basically what comes out of your pocket is $100, and out of your husband's or your spouse's or whatever you want to call them, that's $100. So your insurance costs for the month will be $200 a month. But everybody is covered. And whatever's not used goes into a health savings account. So for the parents, $20 out of that goes into administrative cost, $80 goes into the health insurance, and if the health insurance isn't used, that's $960 that goes over into the health savings account, which is invested back into the country. Now, when you have millions of people doing this, you have a system that is going to create income to divide three ways. And again, I'll get to that three-way in a minute. Now, the other thing is, this is where the government has to come in as well, is they have to start regulating prices. Ladies and gentlemen, does it really take $15,000 to pay for a night in an emergency room, to walk out of that emergency room with basically nothing being done? How about $14,000 for a stress test? Is that reasonable or not? I had a stress test. They sent me a bill for over $14,000. I got the letters here to prove it. But my insurance company only paid $990, and they had to accept it. See, that's what I mean by they have to start regulating the prices for hospitals and doctors. Does it really cost $295 for a 20-minute office visit? Does it really cost $1,350 for a bed in the hospital? I told my sister-in-law, I said, if I ever get sick, find a hospital near a Marriott or some other nice hotel, and I'll stay in that room for $250 a night, let my insurance company pay that rather than pay $1,350. It's outrageous to demand that people pay that much money for an emergency room or for a hospital room. Now, that's the basic of the federal government involvement in the insurance companies. Open the borders, let everybody start bidding, giving out good prices. Next thing they do is they have to come up with a menu. Basic health care, everybody, $100. Do you want prescription drugs? It's an extra $20. Do you want hospitalization? An extra $20. Do you want catastrophic? An extra $100. I mean, these are just suggested prices. The insurance companies and the government have to sit down and create a menu of what they can charge. But let's say that you're a single person. You get the basic coverage of $100. You get $20 coverage for prescription drugs. You get $20 for hospitalization, and you get $100 for catastrophic. Out of that, what you pay is $20 administrative costs. So add the prices up minus the $20. If you don't use that for a year, it goes into the health savings account. And that health savings account builds up to the point where the dividends and interest are coming back into it. Now, again, we'll talk about that in a second. Then for those people who are provided medical care for low-income welfare recipients and indigents, even foreigners coming into this country, and we'll talk about that in a second. But those who cannot afford the insurance, Uncle Sam picks up the cost through Medicaid. And they pay $100 a month, just like everybody else. Well, again, there are a lot of people there that will not go to the doctor. Don't want anything to do with the doctor. They're healthy, they're well, they're enjoying their life. Only if they catch a cold now they can go into the doctor and get some prescription drugs. But most of the time they just take the over-the-counter stuff. But for those people, anything that they don't use goes into a health savings account for the federal government. Keep that in mind. So here the federal government's paying, but at the same time, they're getting money coming back into their health insurance savings account. The people are covered. If it's an indigent and it's a catastrophic, all right, the government's going to suck the cost, but eventually it's going to come back to them. When you start building up money in the health savings account that can be invested into the country. Now the country's sitting there saying, gee, we have more money. We can start hiring more people. For those that are on low income that have been working for the company, now we can give them pay raises to put them above the poverty level so that they can start paying for their own insurance. So they come off the Medicaid insurance, and automatically, when annually you have to put in how much money did you make last year into the insurance companies. Insurance companies see that you no longer need Medicaid, you're automatically enrolled into your own insurance company or your own insurance plan. And that way, the money coming in from the dividends helps to do that, because that dividend money, or that money that we put into the health savings account, is invested back in the country. Very plain and simple. And ladies and gentlemen, when you're talking 330 million people in this country paying $100 a month, that's an awful lot of money. And then you subtract the $20 per person for the administrative costs to the insurance companies, and they're making a lot of money. So understand, it's a win-win situation. And whatever goes into the health savings account gets invested in the country, and those dividends and interest come back, and like I said, they're divided three ways: administrative costs, personal health insurance accounts, and federal health insurance account. That federal health insurance account goes to offset the cost that the federal government is paying. Now, it's not going to happen overnight. It's going to take a while. But, you know, if the insurance company is making $250 million on their portion, maybe they don't need the whole thing. They can throw a portion of that over into the federal government. You see, this is people taking care of people. This is people taking care of themselves. They don't need it. Pay for it. When you do need it, it's there for you. Don't worry about it. And the more you put into the system, the more that goes into your health insurance savings account, and the more that'll cover you in the long run. Now, I equate this same thing to whole life insurance. Okay, that's the best insurance you can get out there. It's a term policy associated with a savings account that accumulates dividend and interest. And what happens is, as you pay into the account, of course you pay more for it, but as you pay into the account, what happens is eventually the dividends and interest that come back on that account can literally pay your annual premiums for the policy. It may take 10 or 15 years, but at the end of that 10 or 15 years, you've got a $200,000 insurance policy that you don't have to pay for anymore, because your dividends and interest will do it. The same thing with health insurance. Pay into the program, and eventually the program will pay for itself to take care of you. As long as the government regulates the prices and how much they're taking out of the program. If they make $600 billion and they only need $200 billion to pay all of the medical expenses, plus another $200 billion to pay for the administrative costs, then the difference should go back into the health savings account divided between the federal government and the individuals. That may cause that health insurance account to go up. Not may, it will cause it to go up, which means it's more interest and dividends coming back into the insurance company, which can again be divided three ways to eventually where you don't need to pay for health insurance, because the dividends and interest will pay for it. And because it's divided three ways, the insurance companies are making the money necessary to hire the people to keep the program going. How more simpler can you get? But the federal government wants to stick their nose into our lives, and we have to stop that. We have to stop it. They cannot do that any longer. We have to say enough is enough. So understand, this is the way the system should work. Now, if you're rich and you want the best possible catastrophic insurance and you're willing to pay for it, which means you call up a doctor and say, I'm sick, they're going to open the door and have you come in right away, that's going to cost you money. If you want private concierge doctors, that's going to cost you money. You can have that. You can, because you're paying for it. You have that right as long as you pay for it. But don't force the government to do it. You pay for it yourself, and anything over and above what you put into the system goes into a health savings account, just like everybody else. And you get to cover your medical costs later on down the road. And I say it's for every man, woman, and child. There's no more family plans. There's no more worrying about being on the insurance till you're 26. If your parents want to pay for your insurance till the time you're 50 years old, that's their choice. They can continue to pay for your health insurance. And again, you're going to be covered. So understand, this is a great system. I'm willing to sit down as an accountant because I do have a degree in accounting. And I'll sit down with the federal government and with the insurance companies, and we'll work out a plan that'll benefit everybody and take government health care out of the hands of the federal government and put it into the hands of the insurance companies. Plain and simple. And we should come up with reasonable expenses. And if the doctors don't like this, hey, there are other countries that'll take their services but won't pay them as much as we pay them today. Listen, ladies and gentlemen, my name is Pastor Bruce. Thank you very kindly for listening. Again, I hope you pass this on to your friends, even your government representatives. Let them listen to it and let them make the decision of whether or not they want to continue to screw the American people with government-controlled health care or put it back in the hands of the corporations, the insurance corporations. Thank you. Again, God bless. Take care, and we'll talk soon.